I got another nursing video for y'all today. Today's topic, LVNs. The pros, the cons, and why I decided to become one. Let's discuss. Hi everyone, I'm Keeks and welcome back. If this is your first time here, I post nursing videos every Friday, so go ahead and hit that like and subscribe button down below so you don't miss a thing. Okay, for those of you that don't know, an LVN or an LPN is a licensed vocational nurse or a licensed practical nurse, respectively. So what does that mean? So to start off with, let's get this straight. We are nurses. So in nursing, there are different levels of a nurse. The entry level being, you guessed it, LVN. It goes on to RN, BSN, MSN, DNP, and the list goes on, especially with all the specialties that are out there. And I hate to start anything off on a negative, but one of my biggest pet peeves is the fact that most people just don't think LVNs are actual nurses. And that's coming from both patients and other nurses. So I'm here to set the record straight. I'm going to talk a little bit about the pros, a little bit of the cons, and just why I decided to become an LVN. Okay, so pro tip number one has to be the time is spent in school before you actually get your license. My school offered it in just 12 months. I've seen other schools going for up to 18 months, but 12 months is pretty much the standard for LVN. And from there, you already get your license, you're already on the field, you're already a nurse, getting experience, and on the job doing everything that a nurse entails. Pro tip number two has to be the cost that's involved with going to school. I was in school for only 12 months, so it really helped bring down the cost that was involved with going to school for that amount of time. Now, I did go to a trade school that did cost quite a bit more than a community college would have cost or any other one. I believe my school was actually the most expensive school in the city. But even with that, it's still significantly lower when it comes down to what it costs for a RN school would be. Okay, pro tip number three, it has to be the experience that you gain on the job. You're already on the job. After 1 year, you are a nurse, you're working the field, you've already gone through orientation, you're already doing all the things that a basic nurse is just starting out learning, is doing the IVs, learning the medication administrations on how policies work, the whole rigmarole that goes into starting off being a brand new nurse. You started that already on 12 months. And so you're getting that experience. By the time everybody else has gotten their RN, you've already had your year, your 2, even 3 years in experience as an LVN. Before these nurses, RNs, come out onto the field, you've already shown and proven just how valuable you are. Now, the fourth pro has to be the fact that you are experienced and you do know and understand, is this job right for you? Unfortunately, there's a lot of people that go into school and they become a nurse. I'm talking about BSNs that never had any experience, and now they're stuck paying a bill on a job that they just don't like. Nursing's not an easy job. You know, you may feel that you want to help people. You may feel that this is your calling, but once you get out into it, it's a whole different career path than you've ever experienced before in your life. There's patient cares, there's people's lives in your hand, there's a lot of anxiety, there's a lot of patient care where there's like, sometimes there's disrespect, sometimes there's a lot of different type of dramas that come into play. And if this is just not what's for you, you just spent all this money and time going to school for a job that you really just don't care for. So as an LVN, you really got to get out there and you have that experience of actually working on the floor, working in the field. And if you decide that's not for you, that's okay. You get to walk away with a lot less holding you back. Now, the fifth pro has to be the pay. You're going in as a nurse. You're already getting nursing pay. You're going to be in there with a year, 2 experience before that RN already finished their schooling at the same time that you started. You know, you're already on the field, and sometimes you can actually make more money than an RN coming out straight out of school with your 1-2 years of experience, depending on the field and depending on the job titles that you take as an LVN. So that's something to be thought about when going further, that maybe pay isn't that great as a factor when it comes down to what you're going to be, an LVN or an RN. All right, so we're going to go ahead and get into the cons now. To start off with, we're going to go back a little bit into where people really didn't think that LVNs were real nurses. So one big thing that we always hear as LVNs is, when are you going to go to school to become a nurse? Or when are you going to go to school to get your RN? It's almost constant that you hear, when are you going to go back to school? Because they really just don't take LVNs seriously for the most part. We have quite a bit of experience. Some of the best nurses that I know are LVNs, are started off as LVNs and became even better RNs. So for that, it is a huge pet peeve of mine that how many times do I hear in a week, am I going to go back to school, or when am I going to go back into school? So for con number 2, I'm sure this is something that every LVN has experienced at least a few times in their career, and it is the dependency on the RN. Like I discussed earlier, I was talking about how the LVN is the entry-level nurse that is followed by the RN, and according to our practice, we are under the direct supervision of an RN. So there are certain things that LVN cannot do on their own. Blood administration, maybe some hypertensive medications, anything that would drop their heart rates, or different types of medications, procedures that an LVN can just not do on their own, that needs to be done by an RN. And it does make you feel like your position is hindered, or that you are hindered as a person or as a nurse, that you have to go and get an RN for that. Sometimes you have to get a less experienced RN. And honestly, I've had to walk an RN through a procedure on how to do something that I was not able to do. That's kind of annoying, and it is something that I'm sure all career LVNs have had to deal with at some point in time. All right, so cons number 3, 4, and 5 all have to do with nursing school. Now, to start off with, as an LVN, complacency is probably one of the biggest issues that you have. You get complacent in the field that you are already a nurse, you're already making pretty good pay, you have some good experience, and you're in the job field. You don't want to leave work that you've already established with to go to school and have to work out a schedule and go right back into school that you just finished, just to get your RN, to do something that you've already been doing. So that is kind of a big issue that we just don't realize when we first get into being an LVN. Con number 4 is actually a contradiction to con number 3, whereas now you have to actually forget part of being a nurse in order to go into nursing school again. So you've already have this experience. You already have everything. You already know what you've been doing all these years. Now you got to go back to RN school, and you have to realize, how is it that I'm going to handle this now? The NCLEX is very different between the LVN and the RN on how you manage and how you approach a patient and how you do an assessment. So you have to kind of think back, well, this is how I do things, but actually that's not how they're going to ask you how to do it in the NCLEX, and it's not how they're actually asking you to do it in school. So forgetting what you already know, all that experience, to try to focus on a different way and a different mentality is something to consider. And con number 5. So what happens is, when you go to RN school, there is some RN schools that do not take the credits from the LVN schooling. Actually, the RN school that I was going to go to previously was actually the same school I went to as an LVN, was actually making me do some of the same classes that I had already done as an LVN. It was kind of ridiculous, honestly. So now that I'm going back to school again at a different college, some credits they did give me, but for the most part, I'm not going to be able to get that back, and I'm going to have to retake some of these science classes that they weren't pretty much transferred over. And that's a big thing that I don't think a lot of people realize, that when you're going to go back to RN school, all those classes that you took as an LVN, you got to take them again. And somebody really should have told me that when I first started. Probably wouldn't have changed my decision, but it would have been nice to know. All right, now, so I'm going to go over some of the myths that have been floating around LVNs. Now, I've been an LVN for going on a decade now, and I've heard quite a bit of things, and I've heard it since then. I've heard it from LVNs that have been LVNs twice, 3 times as long as I have. And first one always that you hear, I heard it straight in nursing school. I heard it on my first job. I heard it everywhere. And it's that they're phasing out LVNs. Now, of course, they are pretty much phasing out LVNs in hospital care, some places. Even in the hospital that I'm working at, they're really pushing for us LVNs to get back, get our degree so we can move on to RN and be further out, because they're kind of wanting to just go into not having to deal with having an RN manage the LVN in a patient care setting. But the fact of the matter is, LVNs are in very, very high demand throughout all of the fields of nursing. There are so many different fields of nursing, from long-term care to management of clinics to research to you name it. There's just so many places that an LVN is needed. And a lot of times they're requiring all these RNs to be in the hospital. They're having a big vacuum of nursing shortages everywhere else. So they're going to get paid high when you go into some of these other places that the RNs are actually moving towards the hospitals, because they're now getting bonuses and they're doing all these other things to join a hospital. So I don't see them phasing out LVNs anytime soon. It's been something talked about for decades and decades, and it just never happens. So don't worry about it. So going back to that, is there is no jobs out there, and there is definitely plenty of jobs for LVNs. Now, I hear about it all the time when I came out of nursing school, is all my friends just trying to get a job. They're like, I applied here, I applied there, I applied there, and they want experience, or they want to have an RN. And a lot of times they're trying to apply to places where it's a little bit more desirable. Understandably, those jobs are going to be harder to get into, but there's still a lot more, getting your feet wet. That's kind of the theme of just having a new career. You have to get your experience. So sometimes you may have to go into a skilled nursing facility or a rehab center or something before you can gain that traction, before you can gain that experience that's going to allow you to apply for some of those managerial positions, to apply for some of those areas. So don't be afraid to take some of those undesirable jobs, because that's going to get you to the place that you need to be. And of course, going back to the no money in being an LVN, once again, there is plenty of job opportunities that will get you that money that you needed to get that pay, to pay back those student loans that you got. I know there's a lot of people that are out there that have single parents that are just, starting their career for the first time, or starting their career, having a career, and they need to go back out there. And that pay that you sacrifice on that 1 year of school is going to get you enough. I had a really good friend in nursing school, and she ended up paying her student loans back in 6 months after just working. She had 2 jobs, and one of them was doing agency, and it paid very, very well for her. She, buckled down, still kept the same budget that she had while in nursing school to pay those student loans off, to not have any interest, and to then afterwards she was free of all that debt and went back to RN school right away, again trying to do the same thing. So there is quite a bit of pay still for LVNs to be out there. And I know actually a lot more LVNs that get paid quite a bit more than I do. I choose to be in the hospital setting because I choose the experience that comes along with it. I choose the setting, the people that I work with. I really appreciate hospitals, but you don't have to do hospitals if, sometimes the pay is more necessary, especially when you're trying to focus on your family and get out there. So in conclusion, I love being an LVN. I think it's probably the best decision in nursing I could have done for myself at the time that I could have done it. Going out there, I think if you are a single parent, if you're trying to get into the medical field, or you're just trying to get into your career that you're desiring, and you can get into that technical school or anything that would provide you that stability right away, definitely get into it. You get that pay, you get that stability, and you get that experience without having to sacrifice more time, more money into school. You find out if this is for you, and you find out if this is where you want to be. And with that, you can move forward, or you can go somewhere else. So go ahead and give LVN a shot. I guarantee you're not going to regret it. So thank you again for watching, and I hope to see you next time. I appreciate you for watching this video, and if you liked what you saw, go and hit the like button down below. And if you want to follow me more on my nursing videos, go and hit the subscribe and notification bell so you don't miss a thing. I post every Friday, so thank you again, and God bless.